Okay, would like to welcome everybody to the DNPAO seminar series. We have an exciting session for you all today. I'm your moderator for today. I'm Janelle Gunn. I lead our Office of Policy, Partnerships, and Communications in CDC's Division of Nutrition, Physical Activity, and Obesity. Just a few housekeeping things. The seminar is being recorded. It'll be posted at a later date on the CDC website. All lines are muted, but we do encourage Q&A, and we'll have time at the end for some Q&A. So you can use that feature there on Zoom to put in your questions, and we'll get to as many as we can at the end of the seminar. So I'm very excited about our session today, and it's focused on increasing physical activity through community design in states and communities. We have an all-star panel lined up. So first we'll hear from Lieutenant Dave Ederer. He's a senior assistant engineer in the U.S. Public Health Service. He's also an epidemiologist in the Physical Activity and Health branch here at CDC, where he studies active transportation. He has served as a technical advisor to the U.S. mission to the United Nations and the United Nations Road Safety Collaboration, and as an epidemic intelligence officer. He has served in all those roles. He has a PhD in transportation systems engineering from the Georgia Institute of Technology. He will be followed by Tiffany Smith. She's a program manager from Vision Zero Network, and she's a public health practitioner who works with transportation professionals, advocates, and policymakers to advance health equity, income equity, and racial justice priorities in Vision Zero work across the nation. She also aids communities in deepening their understanding of the safe system approach to implement road safety strategies that are proactive, equitable, and holistic in nature. She brings her public health experience to Vision Zero by integrating collaborative and systems level thinking to a roadway safety interventions. And then she'll be followed by Steph Leonard. She's the Built Environment Coordinator at the Colorado Department of Public Health and Environment. She's a planning and public health professional with multiple sector experience in active transportation, policy, and community design. As a Built Environment Coordinator, she collaborates with local, regional, and state partners to create active, friendly communities through policy and environment change. Okay, so our agenda today for the next hour is first we'll hear about safe systems and community design, followed by state experience, a cross-sectional collaboration towards safe systems in Colorado, and then safe systems in pyramid in action. This will all conclude with a Q&A. So again, put your questions throughout the webinar into the Q&A. So taking just a quick step back, we're considering how community design can support meeting physical activity recommendations. And we promote some of this through our work here at CDC and Active People, Healthy Nation, which we're trying to help 27 million Americans be more physically active by 2027. And then just a quick reminder of the physical activity guidelines, the goals that we're aiming for. So on the slide here, you can see the guidelines for adults, which is to achieve 150 minutes a week and at least 2 days per week of muscle strengthening activities. So excited to see how the design of a community can help support these goals. Also want to note that the work here today supports the National Strategy on Hunger, Nutrition, and Health, in particular Pillar 4, to make it easier for people to be more physically active, in part by ensuring that everyone has access to safe places to be active. Just wanted to make a note too that this national strategy has a specific call out for Active People, Healthy Nation and expanding it across the country. And then lastly, of note for you all, the national strategy under the whole of society portion has an opportunity for state, local, territorial governments adopting jurisdiction-wide plans and proclamations to promote Active People, Healthy Nation, as well as adopt and implement complete street policies and safe routes to schools programs. So many ways in which you all can also be involved in physical activity. All right, now let me hand it over to our first speaker. I'm going to welcome Dave to the virtual mic.
Thanks, Janelle, for the introduction. I really appreciate it, and I'm excited to talk about safe systems with everyone today. And really, I want to emphasize that safe systems is a public health approach, and it's a public health approach in transportation. It's been adopted by USDOT as the National Roadway Safety Strategy, but it really has its foundations in public health, as a lot of civil engineering does. So hopefully by the end of our talk today, you'll get a little bit of an idea of how transportation and engineering in general serve public health and how we use the built environment to create healthy people. So you may not know this, but way back when CDC was founded in the 1940s, and when it first became CDC, the Communicable Disease Center at the time, we actually had something called an engineering division. So this is CDC's original org chart. If you look at the original CDC bulletin, um, you can see how CDC had organized itself. And I've highlighted the engineering division here, and it's one of the only divisions that no longer exists today. So if you, all these other different divisions, laboratory entomology, they all exist in some shape or form, but we've kind of gotten away from engineering and thinking about the built environment, although it's core to our mission and what we do. And it's so core that CDC used this little cartoon when they would explain what they did. So they were a brand new government agency. They're trying to explain to people what public health was and what CDC does. And at the time, CDC felt it was a place where physicians, biologists, and engineers came together to think about public health issues and improve the health of our nation. So this is actually an old idea. We talk about intersectoral collaboration and working across silos. CDC has always thought and understood that this is key to what we do, and engineers were key players in that. And you probably know that most CDC directors are medical doctors, including our current CDC director. Uh, Two CDC directors have not been medical doctors, including the first one. And I've pictured him here. His name is Dr. Mark Hollis, and he was actually a civil engineer. He's, again, one of only two people that aren't medical doctors to lead CDC, and he was the first person to lead CDC, and he was an engineer because what they understood at the time was that altering the built environment was a key way that we can improve our health. And there was a clear role for public health engineers to the extent that the American Journal of Public Health even had something called the public health engineer. And there was debate about what the role of engineers was in public health. And I love this quote from a 1931 edition of AJPH. We now recognize public health engineering as an essential calling, the prime object of which is to control the factors of the physical environment, especially as they affect the health and welfare of groups of people. And I think that's what we try to do in our division and with all of our programs is think about how we can alter the built environment to affect the health and welfare of aggregates of people. And I don't know if there's any engineers or planners out there, but this curriculum looks very similar to an engineering curriculum today. And engineers, public health engineers in the 1930s even got 2 semesters of transportation systems engineering, which is more than many civil engineers get today. And so how does this relate to safe systems? I want to actually go back to epidemiology and how we think about epidemiologic problems. So I'm sure we have many epidemiologists on the call today, and you probably know the epidemiologic triad where we think about the host, the agent, and the environment. And these 3 things need to interact in order to cause disease, right? And we use this framework in order to help us prevent disease. And to prevent disease, we have to intervene between the relationship of one of these poles. So we can alter that relation between the host and the agent, the host and the environment. So a great example of why CDC is located here in Atlanta is at the time, malaria was endemic to Atlanta, and we needed to alter the built environment in order to stop mosquitoes from transmitting disease, and specifically to populations that were at high risk. And so we were able to use engineering to alter the built environment to decrease the prevalence of malaria with the understanding that there was differential exposures that were related to people working here in the American South. And now malaria is no longer endemic in the American South, right? So we use this core idea behind public health to solve a public health problem. And we can do the same thing when it comes to transportation. And this is a core idea in the safe systems approach. And so the pathologic agent of injury, kind of similar to that virus that might cause disease, is kinetic energy, right? It's the thing that when a human host comes into contact with a high level of kinetic energy in a car crash, injury results. And so we can alter the relationship between a human being and an energy and energy in the result of a crash. And one of the Best examples of that is 3-point seatbelts. So if you think about 3-point seatbelts, they disperse the amount of energy that's transferred to the human body in a crash. So when you're driving at high speeds, you come to a stop, you're coming to a stop at the same speed as your car, but your seatbelt makes sure that energy dissipates across a strong part of your body, like your sternum or your hips, and then you're not injured. This is a remarkable public health achievement and would not have been uh, a technological innovation without epidemiologic ideas underlying it. We can also change how human beings interact with the environment. We tell them that maybe they need to slow down and change speed limits. Maybe there's a school nearby. And then we can also change how vehicles or I'm sorry, energy interacts with the environment with which we're in. So we can have vehicle designs which dissipate the transfer of energy in a crash. So if you think about your car, it has a crumple zone in the front. So when you get into a crash, that energy isn't transferred to the human body. It's absorbed by that steel in your car. Or the same thing goes for a roll cage in your car. We want those strong structures to absorb the energy rather than the human being. However, we don't talk about the population health impact or the health and welfare of aggregates of people, right? So Dr. Frieden, a former CDC director, came up with the health impact pyramid, and he emphasized that we want to increase population health impact with our interventions, and we do that by decreasing individual effort. And he outlined different ways in which we do that. And to connect this back to safe systems, we really need to think about how we do things at the base of the pyramid to increase population health impact and decrease individual effort to achieve those safety benefits and make things like walking and cycling the safe and easy choice. The primary means by which we do that is by altering the built environment. When we change the built environment, we're exposing populations of people to the benefits of physical activity. And those are long-lasting protective interventions that don't require a lot of individual effort. You make it a safe, easy, and logical choice. So to go back to our example about public health engineering, there's a lot of discussion about this in the 30s, and I hope we can get back to that, and I hope you can implement this in your work. So what was really key for public health engineers was not that they know how to build a sewer or whatever public health infrastructure they were working on, but they know why sewers were necessary and what results may be anticipated by the treatment of a body of water. And we can think about the same thing with our transportation infrastructure. So if you talk to a transportation engineer or a planner, they can probably tell you to the third decimal point the curvature of their roadway. But can they tell you that transportation is linked to 8 of the 10 leading causes of death in our country? And that physical activity is an important protective factor for cardiovascular disease and many of the other leading causes of death that are listed here. I think every engineer and planner should know this and know that the infrastructure that they build is directly related to the health and welfare of aggregates of people. Furthermore, we know that when people are able to be physically active, when it's a safe and easy choice, we can do much more than just influence cardiovascular disease or cancer. And in fact, it's an important treatment for mental health problems and depression. So a review of randomized control trials this year in the BMJ showed that the effect of walking is comparable to that of pharmaceuticals in treating depression. This is an amazing result. And if you look at the other things studied here, very few of them act at the population level and require a lot of individual effort. So this isn't to say that those other interventions aren't important, but we can and should make it safe and easy to go out for a walk. That's a really important thing to improve the mental health of populations. And furthermore, these transportation policies that you're going to hear more about are important to health and medical spending. A brand new review of Vision Zero in New York City, the first city to implement Vision Zero at a wide scale, showed that Medicaid spending was $90 million less over 5 years than expected. So when we improve the built environment, we can expose people and make it safe and easy to walk, cycle, and get the protective benefits of physical activity and save money on health insurance while we do it. So Steph and Tiffany are going to talk a lot more about implementation of these ideas, but I wanted to give you the foundation of how this is really a public health idea founded in core public health methods and epidemiology. So I look forward to your questions. Thank you so much.
Thank you, Dave, for the introduction and for laying the groundwork for the safe systems conversation we're having today. And thanks for all of you for tuning in. I am a built environment coordinator with the Colorado Department of Public Health and Environment. I'll be sharing today about how we in Colorado have enhanced interagency collaborations and aligned internal work plans with the safe systems approach to support communities to employ built environment and behavioral strategies that increase safe physical activity. The goal of our work through the Colorado State Physical Activity and Nutrition Program is to pursue community design that increases access to physical activity through active transportation. As the slide demonstrates, incorporating a safe systems approach into that work is paramount. In recent years, active travel fatalities have been increasing, and we see on the slide in 2022, 764 people, of the 764 people that died on Colorado roadways, 115 people were walking and 15 people were bicycling. So we keep this in mind as the framework for all of our efforts of promoting safe physical activity. So to address both safety and access for people walking and bicycling, we internally restructured at CDPHE to combine teams to work across different levels of the safe systems pyramid. So our new Healthy Communities unit now includes both the built environment team, which is focused more on socioeconomic factors and the built environment, as well as the motor vehicle safety team, which is focused more in that active measures and education realm. And this restructuring helps align the strong partnerships that each team has developed over the years, particularly within the Colorado Department of Transportation, to establish more holistic collaboration that increases transportation safety. As an overview of relevant work within our Healthy Communities unit, so historically our built environment team has received funding from the CDC through the State Physical Activity and Nutrition Program to implement state level policies and activities in connection with communities that connect activity-friendly routes to everyday destinations and increase opportunities for safe physical activity. The motor vehicle safety team also works in this active transportation space, but they're braiding together funding from the National Highway Traffic Safety Administration in collaboration with CDOT's Highway Safety Office, as well as the CDC through the State Injury Prevention Program. And this work is to provide data analysis and support community-led strategies that will reduce fatal and serious injuries, crashes that are related to fatal and serious injuries for people actively traveling. Much of the groundwork for this cross-sector collaboration began during the previous round SPAN 1807 funding, when members of our team partnered with CDOT to inform two overarching plans that guide transportation in Colorado. On the left, you see the statewide transportation plan, which establishes Colorado's transportation investment priorities and serves as a guide for subplans like our active transportation plan and funding programs like Safe Routes to School and Revitalizing Main Streets, which I'll talk about in the following slide. The current plan is the first version that includes language about public health and equity, which was an outcome of a public health equity and transportation task force created during the last planning cycle. Similarly, on the right side, you'll see the Strategic Transportation Safety Plan, which establishes a vision and mission for the transportation safety efforts in Colorado, highlighting that enhancing multimodal transportation safety requires cross-agency and interjurisdictional collaboration in policy, planning, funding, design, construction, operations, maintenance, like the whole process. So over the next few slides, I'll touch on programs, initiatives, and assessments that relate to implementation of these plans. So Safe Routes to School and Revitalizing Main Streets are two of CDOT's active transportation funding programs. I imagine many of you are familiar with Safe Routes, but Revitalizing Main Streets is a Colorado-specific program that emerged as a COVID recovery initiative and has since been fortified with 10 years of dedicated funding at the state level. This program enhances active transportation safety, encourages physical activity, and strengthens the connection of people to main streets by funding infrastructure improvements to make walking and bicycling easy and safe. Our team partnered with CDOT to develop this program and continues to sit on the review committee to offer both public health and motor vehicle safety perspectives. In connection to our SPAN work plan, we've been working with CDOT staff to look at historical funding of both of these programs to identify which communities across the state have received funding, which ones haven't, and overlaying these data with the state's map of disproportionately impacted communities for the purpose of identifying communities that may benefit from additional technical assistance. And we hope to use this information to help round out some of the active transportation improvement efforts we're seeing. So for example, communities that have new infrastructure, like a new bike lane, how can we come in and build capacity with communities on programmatic strategies that could increase the use of new infrastructure and vice versa. Another cross-agency effort in support of safe systems is the Advancing Transportation Safety Initiative, which is a statewide effort to help implement the Strategic Transportation Safety Plan. ATS, as we call it, is led by a team of state and local agencies, advocacy groups, academic institutions, and private entities to build a unified approach to transportation safety through education, engineering, enforcement, emergency response, equity, evaluation, and then broadly, like an evaluation category. So you'll see on the right side, this circular graphic. It shows the 5 themes of our ATS groups, which you will notice align with the Safe Systems approach. And these groups meet monthly to increase coordination and information sharing, as well as implement evidence-based safety countermeasures. And just one example of an outcome of this group already is the screenshot on the right side, which is from our public website that is used to share data and report on progress within these groups. So as a result of some of our regular partnership, CDOT invited members of our team to support the creation of the Colorado Vulnerable Roadway User Assessment. So as context, the 2021 bipartisan infrastructure law requires that each state identify areas where people who ride bikes and walk are at higher risk of being involved in a crash that results in death or serious injury, and then work towards making those locations and populations safer. So this assessment is a high-level plan that considers both safety and equity across the roadway system and uses the Safe Systems approach as its guiding principle. And this is a first-time effort, but within this assessment, we did include an equity analysis that combines crash data with our Colorado EnviroScreen data, which is an environmental justice mapping tool. And you'll see on the screenshot here of that tool, these are communities that have been identified as disproportionately impacted communities based off of our state definition of disproportionately impacted communities. That was a part of Colorado's Environmental Justice Act in 2021. And we used these data to create a statewide high injury network for people walking and bicycling. So that network includes 39 locations, with 92% of these corridors located within disproportionately impacted communities, according to that definition. So with this round of SPAN funding that we received in Colorado, our team has adapted CDC's Active Communities tool for the action planning framework, and we use it to guide our work with community in Colorado. So our approach is still expanding, but our goal is to help communities move along this continuum to promote safe, active travel. So I'm just going to focus in on some of these call outs. These are ways that we're kind of tailoring the framework to promote components that are specific to Colorado, like our Colorado Community Engagement Toolkit that can be used for community engagement. We're supporting communities with traffic safety and health data analysis. We're providing insight towards both built environment and behavioral strategies in community action plans, and then working towards some Colorado-specific funding sources, such as safe routes to school or revitalizing main streets. And we're in the process. Well, we have set aside some funds to support community-led, like mini funding opportunities to trial out both behavioral and built environment strategies before communities commit to some larger scale funding. And a related effort is we're recognizing that more communities are applying for safe streets and roads for all. So we're in the process of exploring how across different agencies, state agencies, we could be supporting the creation of safety action plans within local communities. So this slide is kind of touching on some of our work in progress, which includes partnering with 2 regional planning organizations that are in areas that have received Safe Streets and Roads for All and are in process of creating those safety action plans. Mesa County we've been working with Mesa County Regional Transportation Planning Office on some high-level strategies that could be included in these action plans, as well as, doing just kind of regular listening sessions as requested. We've also been working with the Pueblo Area Council of Governments on various related efforts, like the development of some complete streets policy language, or more programmatic level components that align with complete streets, as well as continuing to be in kind of regular listening sessions with our partners in Pueblo. And then finally, we are in the process of partnering with the Highway Safety Office to develop like a mini funding opportunity. I alluded to this on a previous slide, but what are ways that we can support local efforts to implement behavioral strategies that improve safety for people walking and bicycling? So through some of these listening sessions, and we've been doing outreach to partners across the country who have potentially been doing similar work previously. How can we be setting aside money to really support community-led action towards safe systems improvements? That is all for now. Thank you, everyone, for listening. I'm going to go ahead and pass it off to Tiffany Smith with the Vision Zero Network.
Thanks so much, everyone. Just want to say thanks so much to Dave for orienting us to the safe system approach, and to Steph for sharing the work that they're doing in Colorado. I'm Tiffany Smith, the program manager for Vision Zero Network. We are a national nonprofit that helps communities and practitioners advance their goals of Vision Zero while increasing safe, healthy, equitable mobility for all. As we've heard today, decisions related to our everyday transportation systems really intersect with so many consequential aspects of our lives: our access to healthcare, our employment, our education, and more. And because of this, transportation and roadway safety issues are also systemic issues. And so before I get into what I'll be talking a bit about today, I included this version of the socio-ecological model, which basically emphasizes that people operate in systems that present choices for behavior. And so, as Dave highlighted, we have to make safe walking and safe environments and safe driving the easiest and most rational choice, which is also reflected in the socio-ecological model. And so to improve safety, we have to really build that into our systems. And so the strategies, as we've heard earlier, that we know will kind of be least effective are those that really focus on or focus at the individual level. And those that are most effective will reach all segments of our society, they'll work upstream and be proactive. And so today I'm going to just highlight a few examples of how different communities across the country are really scaling up their safe system approach-based work. So in Philadelphia, one example, and they're doing more than just kind of sort of laying this out in their plan, but one example to highlight that I think is kind of simple, but pretty critical, is shifting their Vision Zero action plan from the ease or the traditional approach to the safe system approach. In the first plan, sort of set up in the traditional way, they list engineering, for example, as a priority, and say engineer streets to reduce the risk of crashes. But when compared to the Safe System Approach-based plan, engineering's role still shows up, but almost in a different way. It shows up a few ways, but one way is creating roads that are predictable and aren't confusing for anyone using them. And so when you think about it, this priority requires a multitude of tools, including engineering. And so not only do the priorities laid out in the Safe System Approach-based plan kind of break down silos, but almost come across as clearer and more actionable. Other examples, and in Seattle, they are doing this by prioritizing safety over speed. So recognizing the key role of speed and the severity of crashes, the city began to kind of take a more distinctly proactive approach to lowering speed limits across their entire network. They changed the Seattle Municipal Code to reduce citywide default speed limits, lowering the default speed limits on non-arterial roadways to 20 miles per hour, and the default speed limit was lowered on arterial streets to 25 miles per hour. And they did this specifically without increasing enforcement and saw a reduction in speeds on 70% of their arterial roads. In addition to kind of scaling up speed limits, communities like Fremont in California are also scaling up these kind of quicker, lighter touch system design changes. They've added in more than 12 protected intersections, reduced travel lane width, installed quick build bulb outs. And I just want to say that, you know, these might sound relatively simple or straightforward, but these changes are really critical to improving safety in our system, in our transportation system. And they're really just now starting to kind of be realized across the country. And so as a result of all of these small changes all culminating together, they saw a reduction in 45% of their fatal and severe injuries over the past 5 years. Other communities are collaborating across departments to kind of incorporate the intersections between transportation and safety with health. In Clackamas County in Oregon, they have a jointly funded public health and transportation staff member whose main job is to incorporate health and equity into the county's long-range plans and projects. This position is used to inform the development of scopes of work so that they're more holistic and cross-cutting. The position also serves in like an advisory role on advisory committees to inform so that the projects are, again, kind of thinking more holistically, balancing out unintended consequences. But they also develop health impact assessments throughout the phase of projects. Collaboration can also take other forms, as we've heard from Steph, in the form of data sharing. Other communities like San Francisco are integrating hospital data, working with their hospital network and EMS to paint a fuller picture of injuries. Today, many communities will often rely on police data to kind of paint a picture of their crashes, but this data doesn't often provide a lot of insight on injuries. And it's also known to undercount injuries experienced by communities of color or low-income communities, as they're often underreported despite having higher hospital admission rates. And so with that in mind, to kind of fill out what we see with police crash data, maybe you're not able to kind of collaborate with your hospital network. Other localities, like in Nashville, they are layering their high injury network. And for anyone who's not familiar, your high injury network is essentially the area where there's a higher concentration of deaths and serious injuries. And so they're layering their high injury network over other data on related to kind of what areas have high rates of those living in poverty, what areas are there lower rates of home ownership, or where there's a high concentration of active transportation users, or carless households, and more. And they're using this to kind of understand how this disproportionate burden of safety risk manifests across inequities and to inform their planning and prioritization process. And as you'll see, the data shows that 37% of all crashes occur in highly vulnerable areas, despite these areas accounting for only 20% of the total Nashville population. And so unfortunately, this is very common, as Steph highlighted in her presentation. And here I could have taken this from any plan, and we'll see these inequities show up. Which is why communities like Nashville and in Oakland, California, they're also prioritizing safety investments in these areas. And when I say prioritizing, I don't just mean like giving these areas projects first, but investing more proportionally or thinking about the scale. Some communities might need multiple projects to happen in succession, as opposed to in isolation, for there to be a really impactful benefit. And in Oakland, they developed this geographic equity toolbox to really track the distribution of resources and investments in their high priority equity areas. And I think this is also kind of a great example of really addressing the two bottom levels of the pyramid related to like the built environment and socioeconomic factors. But this can also look like kind of what Denver is doing via their community active living program. This program offers micro grants, dedicated allocated funding for projects that have been developed or designed by community members in a way that really meets, in an attempt to really meet the safety needs of their most safety burdened communities. And through this program, they've also been able to really reach communities that have historically kind of been excluded from transportation planning decisions. And interestingly, also wanted to highlight, as part of this program, they also hire community engagement liaisons who have lived experiences in the communities that they are trying to serve, as well. And then finally, another example from Oakland, given what we know about what works, we're seeing communities like Oakland develop internal frameworks to really evaluate whether the strategies being employed to combat a specific safety problem are really working proactively or on an upstream level. In other words, they're really using this framework in their internal planning process to really make sure that they're targeting the lower levels of the pyramid. In almost all cases, we're really going to need to rely on design-based changes to see the safety improvements that we're seeking. And so this is a way of sort of aligning agency-wise and organizationally their priorities. And so with that, just want to emphasize just a few key themes that all of the communities are doing. They're leading with upstream design changes. They're managing speeds for safety. Notice I have managing speeds as opposed to like managing speeding. Oftentimes in this space, there's this sort of overemphasis on focusing on individual outliers or sort of someone going disproportionately higher, but we really need to focus on collectively managing speeds in our transportation network. They're institutionalizing racial and health equity, scaling up changes throughout their network. Some are quick and light, some are more robust, centering safety across their departments and collaborating and reallocating funding in meaningful and measurable ways. And so that concludes my presentation. Thanks so much for listening. And if you'd like to connect, feel free to reach out. I will now pass it on to Janelle. Thanks.
Thanks, Tiffany, and thanks to our other panel members. What a great session we had, learning more about community design. As we move into the Q&A session, would like to remind our audience of some of the resources we have here at CDC DNPAO, including our State and Community Health Media Center. So great access to ads that can be used, or they can be inspirational for some of the communications work you might be doing alongside your physical activity initiatives. Also our data trends and maps site that you can pull up the latest information about the data in your area. And if you're not already, to follow us on X at CDC DNPAO and Facebook at CDC Eat Well, Be Active. So I'd like to invite my panel members to come back on video and we can move over to the Q&A. So thanks everybody for a great presentation. And I'm gonna kick off with a question for Steph first. How do you see collaboration with local communities progressing in the coming years?
Thanks, Janelle. So we are really hoping to step into more collaboration with communities that are interested in the safe streets and roads for all. funding, as well as providing more structured technical assistance along that action continuum that I included in the slide, kind of building off the ACT framework. So we have like a group of partners that we're already working with at local levels. So continuing to provide more specific one-off technical assistance, but then building off of the mapping effort that I noted in my presentation, looking at safe routes to school and revitalizing main streets, funding with the overlay of disproportionately impacted communities, really trying to do more direct outreach in partnership with CDOT to see, where there is interest in active transportation funding with a focus on safety specifically, and really pulling in some of the crash data as well, as like a phase 2 of our mapping efforts. We're wanting to look more at some of the Highway Safety Office data that we have, like looking at who has been funded through some of the Highway Safety Office grants, as well as more of these infrastructure programs. So building out more intentional technical assistance in those communities that we know maybe have not received funding, but there might be interest. So that's a first example that comes to mind.
Thank you. Tiffany, the next question is for you. Can you describe activities related to Vision Zero that occur at the state level? And or is Vision Zero intended to be focused at the city or local level?
Usually, I would say currently, most Vision Zero plans or efforts are kind of happening at the local level. However, I would say at the state level, I think maybe exploring opportunities to make certain design changes easier for localities at the lower level. Oftentimes, like with these high injury networks, a large proportion of those roadways are state-owned roads, so they're not able to really redesign. So exploring opportunities to allow for collaboration between state and localities, or allow for some flexibility around changing speed limits on some of these roadways, as they tend to kind of be the most dangerous roadways. And a lot of them also do cut through like disproportionately impacted communities as well. And I think as well, state Vision Zero efforts can maybe revolve around kind of setting priorities and goals. I think a big part of Vision Zero is like building a collective vision and a collective commitment towards the same thing. And so I think the states can also play a role in helping other localities that maybe haven't committed to Vision Zero begin to make that shift, or maybe aren't familiar or not super comfortable with a safe system approach, maybe do some capacity building there.
Thank you. It's a great lead in for my next question, which is for Dave. So safe systems, I think, is new to some of our audience members today. So where can we go to learn more about safe systems?
So many places. I know Vision Zero Network has plenty of great resources on that. I definitely want to point out the National Roadway Safety Strategy. So that's a US DOT document that comes from the Office of the Secretary. So this has a lot of high-level support and new high-level support. But if you go and you look up the National Roadway Safety Strategy, I think they lay out what the safe systems approach is. They call out public health professionals as part of implementing this, and look at those principles that are in there. And you'll see a lot of public health ideas. And also, talk to your colleagues at your local or state DOT, and they can tell you how they're implementing it in your community, because it's going to look a little bit different everywhere you go. Last but not least, our partners at FHWA, that's the Federal Highways Administration, have many, many resources on this. So they have resources about implementing safe systems in smaller communities, rural communities, big cities, and everything in between. So there's a ton of resources out there. I'll be happy to put a few links in the chat, but always look to your local communities first.
Thank you. Steph, question for you. So you mentioned the ACT tool in your presentation. And can you share how you adapted that tool to be used at the state level and how you implemented that into your cross-sector collaboration?
Great. So again, this is kind of a work in progress. We're familiarizing ourselves more with the ACT tool as a result of the SPAN program, but we see it as a really useful framework for guiding any kind of collaborative effort related to active transportation. So in terms of like creating cross-sector teams, we're doing that currently at the state level. And then how can we work with communities to scale that down to local level? So, helping entities identify who public health professionals might be that would want to be involved in these types of teams, who are regional engineers that would be supportive of infrastructure changes and provide direction in those conversations. And then, as I mentioned, I'm going to touch on a few things I talked about in the presentation and then add more details. So, we've created some Colorado-specific tools. For example, I mentioned the Colorado Community Engagement Toolkit, which is a resource we created with the Safe Routes Partnership and CDOT. And it's really intended to provide kind of like a menu of options related to community engagement that is intentional and equitable. And then through some of our funding through SPAN, we have been supporting communities to actually implement some of that community engagement. For example, we've been supporting Safe Routes to Parks communities that have been funded in Colorado to do things like movability audits. So it's a lot of what we're doing is there are parallels between the state level, like how can we walk through this continuum with our teams at the state level, but then how does that then translate to guidance that we can provide at the local level for communities to do similar work. Towards the end of the continuum, we see things like implementation. So one, at the state level, we're creating opportunities for implementation. So using some of our SPAN funding as well to support communities to create like demonstration projects that can trial out active transportation infrastructure improvements in a temporary form, but then also working to create these new mini funding opportunities that can lean more into some of the behavioral strategies that could be beneficial for promoting active transportation safety. So one, it's restructuring like how we're using some of the money we have at the state level, and then that translates to supporting local communities to then do the work that will lead to seeing new policies, seeing new infrastructure, all of these changes that ideally lead to more active transportation, more physical activity, and increased safety for everyone who's actively traveling.
Thanks. Go ahead.
I was just going to say, if anyone has like further questions, I'd be happy to chat. We can set up a call and we can talk through it, because I know using the tool at the state level is kind of challenging to figure out at first. And we are very open to thought partnership in that.
Amazing offer. Thanks. Tiffany, next question for you. Does Vision Zero efforts also revolve around people with disabilities to make communities more accessible?
Yes, the goal of Vision Zero is not only to achieve zero deaths and severe injuries on roadways, but to create transportation systems that are safe, healthy, equitable for all people using them. So, I also think these issues, as I've highlighted in our presentation, and as we've heard from others, like these are cross-cutting issues. And so I've also seen in many Vision Zero action plans and in my work with transportation practitioners, disability rights activists and groups are always included as stakeholders in the development of plans and in projects. And if they're not, they should be. And so, I just want to emphasize that In order to achieve Vision Zero, it's going to require collaboration. It's going to require thinking beyond just like, oh, this road, is it safe? Yes or no? Like it's also we have to think about any unintended consequences. Who are we missing out? Who's missing out? Who's not included in our planning decisions? So yeah.
Great, thank you. And then Dave, one more question for you. It's a challenging one. How can vehicle design be modified to reduce injuries and crashes with bicyclists and pedestrians? So maybe in addition to protecting the driver, how can we also protect the
Yeah. So
pedestrian?
it's a super question and a really timely one because we're the vehicle fleet is transitioning and we're rethinking how we build our vehicles, right? And we have to think about vehicle size, weight, and shape. Right? This all gets back to that idea that it's all kinetic energy, right? So everybody knows that a bigger, heavier vehicle is going to be more dangerous when you get into a crash for someone outside the vehicle. So what we have to do is take those same ideas that we use inside the vehicle and apply them outside, right? So if you think about how the vehicle is shaped, when it's higher and heavier, it's more likely to cause an injury or death. So we need to think about how we change the shape of the hood so that when it comes into a contact with a person, that it isn't a fatal crash. I could talk about this for days, but I want to emphasize that it is something we can do both in terms of how we engineer the outside of the vehicle, in the shape, the materials we use, so we can use more forgiving materials in our vehicle design. And last but not least, the vehicle fleet's changing. So electric vehicles have a different drivetrain than internal combustion engines, right? So we have this big opportunity to rethink the vehicle size, shape, and weight, right? We don't need all that space for a big engine block in the front of our car because we can put batteries in so many other places. So it's a really big safety opportunity to rethink how we design that vehicle so that unfortunately when a crash happens, it won't be fatal, right? Because we don't have to design those big hoods anymore. So it's a timely question and an important one, in my opinion.
Thank you. So I'd like to wrap up now. So I want to give each of our panel members just one opportunity. If there's anything you want to leave our audience with today, and as I do that, I also want to thank the audience for joining us for the seminar series. So let's go in the order you presented. So Dave, if I can hand it back to you.
Sure, thanks, Snell. I'm actually going to go back to a quote from another CDC director, and it's Bill Foege. This is a little while ago, but he would say, and you'll wonder what public health brings to the table, and we can talk about all the technical stuff, but Bill Foege would say two things, that public health is optimistic. So Safe Systems and Vision Zero are at their heart an optimistic approach to transportation, that we can do this. We can build a safer, healthier system, and that public health is incremental, right? It took us 180 years to eradicate polio after we had a vaccine. It's going to take time, and it's going to take a lot of hard work for us to rethink and recreate the built environment to make it a safer, healthier place where everybody can walk and cycle and get all those amazing benefits.
Thank you. Steph?
I feel like Dave's comments resonated with me. What immediately came to mind is leaning into some creativity and having patience, recognizing that everything worthwhile usually is iterative. So being willing to be reflective in the process that you decide on, and also be willing to recognize if it's not working, and regroup. So yeah, being patient, celebrating the successes, and lean into some creativity through it all.
Thanks. And Tiffany?
Yeah, I was recently reminded of this Audre Lorde quote. There's no such thing as single issues because we don't live single issue lives. And so if there's one thing I want everyone to leave here today is with that. These issues are cross-cutting. We need to think of as Dave highlighted, transportation engineers are public health professionals. Public health professionals are transportation engineers. We also need to think of ourselves as stewards of equity and the built environment, and even when that's hard. And so just want to encourage everyone to initiate conversations with folks whose work even maybe kind of just tangentially relates to this, because it is all related. It will take all of us to really improve our transportation system.
Thank you. Well, thank you all for a wonderful panel today. Thank you to our audience for joining us. This will be posted at a later date on the CDC website. So if you want to watch it again or share it with a colleague, you can do that. And we'll see you later this fall for our next seminar series. Thanks all.